Obstetrics and Gynecology for 6th semester students of the Faculty of Medicine. Obstetrics and Gynecology, 1. Introduction to Obstetrics and Gynecology. Definition. Obstetrics and gynecology is a branch of medicine that deals with the care of women's health, particularly related to pregnancy, childbirth, and overall reproductive health. Objectives. Ensuring the health of both mother and baby during pregnancy, childbirth, and the postpartum period. Preventing and managing complications that may arise during pregnancy and childbirth. Providing comprehensive care for the female reproductive system, including diagnosis and treatment of gynecological issues. 2. Normal pregnancy, gravida. Normal pregnancy refers to a pregnancy that progresses without complications. Understanding normal pregnancy is fundamental to recognizing problematic pregnancies. Signs of pregnancy. Main signs: missed period, morning sickness, breast changes, and frequent urination. Definitive signs: positive pregnancy test, urine or blood, and fetal movement detection. Antenatal care. Antenatal care is aimed at monitoring the health of the mother and baby throughout pregnancy. Routine examinations include physical examination, fundal height, fetal heartbeat. Laboratory tests, urinalysis, blood tests. Ultrasound examination to monitor fetal development. Pregnancy development. First trimester, organogenesis, formation of fetal organs. Second trimester, rapid fetal growth. Third trimester, preparation for delivery. 3. Labor, partus. Labor is the process of delivering the baby from the mother's uterus. There are several stages and factors that influence the course of labor. Labor stages. First stage, cervical dilation until full dilation, 10 centimeters, divided into latent and active phases. Second stage, the delivery of the baby. Third stage, delivery of the placenta after the baby is born. Fourth stage, monitoring the condition of the mother and baby, typically within the first 1 to 2 hours after birth. Types of labor: spontaneous labor, labor occurring naturally without medical intervention. Induced labor, induction is done if labor does not begin naturally. Operative delivery, procedures like cesarean section or vacuum extraction if necessary. Labor complications, dystocia, difficulty in delivery, such as abnormal fetal position. Preeclampsia, a hypertensive condition that can threaten the health of both the mother and baby. Postpartum hemorrhage, excessive bleeding after delivery. 4. Postpartum period, NIFAS. The postpartum period is the time following childbirth when the mother's body recovers from the process of labor and delivery. Physiological changes in the mother. Uterine involution, reduction in the size of the uterus. Hormonal changes, decrease in pregnancy hormones, Increase in prolactin for breastfeeding. Postpartum monitoring. Watch for signs of infection and postpartum bleeding. Support with breastfeeding and psychological adjustment. 5. Gynecological disorders. Menstrual disorders. Amenorrhea, absence of menstruation. Dysmenorrhea, pain during menstruation. Menorrhagia, excessive menstrual bleeding. Pelvic inflammatory disease, PID, an infection of the reproductive organs that can lead to infertility. Uterine fibroids, leiomyomas, benign tumors of the uterus that can cause pain and abnormal bleeding. Endometriosis, a condition where tissue similar to the lining of the uterus grows outside the uterus. Gynecological cancers, cervical cancer, cancer of the cervix, often related to HPV infection. Ovarian cancer, cancer of the ovaries, often diagnosed at later stages. Endometrial cancer, cancer of the lining of the uterus, typically occurring in postmenopausal women. 6. Family planning and contraception. Contraceptive methods. Options for preventing pregnancy, such as oral contraceptives, hormonal pills taken daily. Intrauterine device, IUD. A device inserted into the uterus for long-term contraception. Implants. A device injected or inserted under the skin to release hormones slowly. Sterilization. Permanent methods to prevent pregnancy, such as tubal ligation or vasectomy. 7. Adolescent and menopausal health, adolescent reproductive health, education on puberty, first menstruation, and prevention of sexually transmitted infections, STIs. Menopause, the natural process marking the end of menstruation and a decrease in estrogen levels. Menopausal care includes managing symptoms like hot flashes, sleep disturbances, and osteoporosis prevention. 8. Pregnancy and childbirth complications, preeclampsia and eclampsia. Hypertension during pregnancy that poses high risks for both mother and baby. Gestational diabetes, diabetes that develops during pregnancy. Ectopic pregnancy, a pregnancy occurring outside the uterus, which can be life-threatening if not treated immediately. 9. Maternal and infant health education, importance of antenatal care. Regular checkups to prevent or detect pregnancy complications and ensure the health of the mother and baby. Exclusive breastfeeding. The practice of breastfeeding infants exclusively for the first 6 months to support growth and health. 10. Ethics and professional responsibility in obstetrics and gynecology. Providing information to patients, doctors must provide clear information about procedures and treatment options. Respecting patient decisions. Helping patients make informed decisions about their care, including in cases of abortion or contraceptive choices. Obstetrics and Gynecology in Semester 6 is aimed at providing a deep understanding of the physiological and pathological conditions that affect women during their reproductive years, as well as ways to prevent and manage complications during pregnancy, childbirth, and postpartum.